Spillage of stones in cholecystectomy is also a complication which can happen in future. A future complication of post-cholecystectomy syndrome. What is false statement? It is seen in 20 to 40% of the patients can have spillage of stones. 20 to 40% of the cases have spillage of stones, and it is common with the brown stones, not with the cholesterol stones. It is common with brown stones. May develop chronic abscess in Morrison's pouch. No need to convert to open. So, for example, if I am doing a lap cholecystectomy, there may be sometimes stones will be spilled. Usually, they get collected in the Morrison's pouch. What you should do is do thorough wash, irrigation, suction, and keep a drain. And very important, document there is a spillage of stone during the surgery, because in future the patients can develop a chronic abscess and come back to you with a chronic abscess. Please remember this point. So, on the basis of available studies, lost stones do not necessitate conversion to open operation. That's a very important point. So, lost stones, some 5 or 6 stones are missing, no need to go and open that. So, treatment should include irrigation, attempt to retrieval of the lost stones with the course of antibiotics. Documentation of perforation should be noted, and in future the patients may come to you with an abscess. Okay. So, pigmented stones are more chances of such spillage, and incidence of spillage is 20 to 40%. So, 20 to 40% of the time the stones get spilled. Please don't forget this point. So, retained stones are the stones, secondary stones, which are happening within 2 years. Within 2 years, patient can come to you with an hyperbilirubinemia or an elevated alkaline phosphatase. You should think of retained stone. Ultrasound may not show intrahepatic biliary duct dilatation if stone is not fully occluding. That such type of retained stone within 2 years are treated by ERCP and sphincterotomy and stone clearance. Okay. So, please remember the post-operative stones, post-operative CBD stones, patient coming to you with the post-op CBD stone. There are 2 types. One is retained or missed stone, which happened within 2 years. These are usually cholesterol stones only. Cholesterol are mixed, and they are usually secondary bile duct stones, the stones which jumped from the gallbladder. So, the other one is recurrent stones, which are formed after 2 years. They are formed in the bile duct itself. They are known as brown pigment stones, and they are primary stones. And these cases needs choledochoduodenostomy or hepaticojejunostomy. So, please remember, recurrent stones will be very big. Duct will be dilated. We have to go for a CDD or HJ. Retained or missed stones less than 2 years should be treated by ERCP and stone removal. That's enough. Okay, this is a very important point for your exam. You should not forget this concept of retained stone and recurrent stones for your exams. Okay.